OB is the focus of my practice. I love obstetrics. I love delivering babies. I love just the routine visits. We typically have 13 or so visits to get to know one another. I love getting to know the older brothers and sisters in that process. And a lot of very common questions pop up. One of them is it okay to dye my hair during pregnancy? This is something we used to hem and haw about and say, well, you know, it's probably not going to hurt anything. I mean, if you really feel like you need to, go ahead. Now I can say with confidence, go ahead and dye your hair. There's no evidence that it causes any problems with your developing baby. Other things I'm commonly asked about are travel restrictions. Is it okay if I go on a trip in my first trimester? What about my second trimester, my third trimester? In general, the airlines will let you fly domestically up to 36 weeks, internationally up to 35 weeks. Cruise ships are a different story. You cannot get on a cruise ship if you're going to reach 24 weeks gestation during your cruise. This is something that a lot of people have learned the hard way. They will actually leave you at the dock if you do not meet those criteria. So make sure you know the rules for the carrier that you'll be traveling with and get a note from your doctor. The reason that lunch meat can be dangerous is that if you are to get food poisoning from lunch meat, sometimes that can involve a bacteria called Listeria, which has been associated with some fetal developmental problems and stillbirths. So I personally can't remember the last time I've had food poisoning from lunch meat. I don't know if I ever have. But it's something that if you're pregnant, you don't want to take that chance. And it doesn't mean that if you get food poisoning, it's going to be Listeria. And it doesn't mean that if you get Listeria that you're going to have a stillbirth. But there are these associations, so it makes sense to pay attention to. So I tell my patients, as long as you're getting this from a pretty reputable place, you feel confident about the hygiene of the establishment, or if you're making it on your own, you can generally feel pretty comfortable with that. If you want to be absolutely safe, you can put the meat in the microwave for 30 seconds. And if you really want the cold deli kind of sensation, put it back in the refrigerator for a little while, then put it on your sandwich. So you can be very, very careful that way if you want to. I think, on the other hand, if you're just craving a sub sandwich one day and you want to do that, you're fine. Sushi gets brought up on a number of levels. One is I hear that I shouldn't eat a lot of fish. Well, actually eating fish in pregnancy is very healthy. It's a good source of omega-3 fatty acids, which are essential in your baby's eye development, brain development. So things like salmon and the type of fish that we typically will eat are very good sources of those types of nutrients. One of the concerns with eating fish is mercury levels. In reality, the types of fish that we're eating, salmon, tuna, don't contain high levels of mercury. When you get into some of the fish like shark, mackerel, you have more of a risk of that. But when I question my patients, most of them are asking about salmon and tuna, not shark and mackerel. So if you're eating a good reputable source, I think having some fish several times a week is fine. Sushi, you do have a risk of food poisoning if it's not prepared properly, but again, a place that does sushi well and knows what they're doing, not the gas station sushi that might have been sitting there for a couple of days, I think you're okay from the standpoint of not worrying about food poisoning. What about pets, animals, especially cats? Cats and cleaning of the litter boxes is something that you'll hear a lot of. And the good news is you basically get out of having to clean the litter box for the term of your pregnancy. Your husband gets to do that or somebody else gets to do that. The reason for that is that cats can carry an organism called toxoplasmosis, which if the mother becomes infected with that, it can also cause some problems with the developing fetus. So my advice is whatever level of exercise you are trained up to, you can continue to do as long as your pregnancy is uncomplicated. If you're a marathon runner, you can continue to do long runs. It's not the time to decide to take up marathon running. If you're a couch potato and you might want to ease into it, but if you're trained up to a high level of exercise, you're fine to continue that. Now, if things develop along the way, if we have concerns for preterm labor, then your obstetrician will make some recommendations to limit your exercise.